Good day, students. I am Janea, and our topic for today is standard precaution and transmission based precaution. Standard precaution are the work practices required to achieve a basic level of infection prevention and control. It aims to minimize and, where possible, eliminate the risk of transmission of infection, particularly those caused by blood-borne viruses. Next, hand hygiene should be performed before and after contact with the client. Immediately after touching blood, body fluids, non-intact skin, mucous membrane, or contaminated items. Immediately after removing gloves, when moving from contaminated body sites to clean body sites during client care. After touching objects and medical equipment in the immediate client care vicinity. Before eating, after using the restroom, and after coughing or sneezing into a tissue as a part of respiratory hygiene. PPE or personal protective equipment. PPE includes items such as gloves, gowns, masks, respirators, and eyewear, used to create barriers that protect skin, clothing, mucous membrane, and the respiratory tract from infectious agents. PPE is used as a last resort when work practices and engineering controls alone cannot eliminate worker exposure. If PPE or other disposable items are saturated with blood or body fluids, such that fluid may be poured, squeezed, or dripped from the item, discarded into a biohazard bag. PPE that is not saturated may be placed direct in the trash. Saturated waste generated from the home should be placed in sealable, leak-proof plastic bags before placing in regular trash bags for disposal. Needle stick safety and prevention are implemented to prevent healthcare worker exposure to blood-borne pathogens. Next, the Needle Stick Safety and Prevention Act mandates the use of sharps with engineered safety devices when suitable devices exist. Third, the safety devices on needles and other sharps should be activated immediately after use. Next, used needles should be discarded immediately after use and not kept, bent, cut, removed from the styrene or tube holder or otherwise manipulated. Next, any used needles, lancets, or other contaminated sharps should be placed in a leak-proof, punctures-resistant sharps container that is either red in color or labeled with a biohazard label. Next, do not overfill sharp containers. Discard after two-thirds full of when contents are the full line indicate on the containers. Last, used sharp containers may be taken to a collection facility such as an area pharmacy, hospital, or clinic that provides this service. Cleaning and disinfection. Housekeeping surfaces such as floor and walls do not need to be disinfected unless visible, soiled with blood or body fluids. They may be routinely cleaned with a detergent or only or detergent disinfection product. Most disinfectants are not effective in the presence of dirt and organic matter. Therefore, cleaning must occur first before disinfection. Wet a cloth with a disinfectant, wipe dirt and organic material. Then, with a clean cloth, apply the disinfectant to the item and allow to air dry for the time specified by the product manufacturer. Some patients care items may be damaged or destroyed by certain disinfectant. Consult with the manufacturer of the items before applying disinfectants. Next, safety injection practices. Outbreaks of hepatitis B and hepatitis C infections in the U.S. Ambulatory care facilities have promoted the need to re-emphasize safe injection practices. All healthcare personnel who give injections should strictly adhere to the CDC recommendations. Use of a new needle and syring every time a medicine vial or IV bag is accessed. Use of a new needle and syring with each injection of a client. Using medication vials for the one only whenever possible. Last, safe injection practices packet. Transmission-based precautions. Transmission-based precautions are the second tier or of basic infection control and are to be used in addition to standard precautions. For patients who may be infected or colonized with certain infection agents, for which additional precautions are needed to prevent infection. So, this is the end of our topic. Okay, and I am Janae Aramay Mamaradlo and I am 5 PSC 3 Block 1.